Good afternoon. Welcome to the daily briefing here at the St. Clair County EMA, where we're joined once again with Chairman Mark Kern and Sam Bierman from the St. Clair County Health Department. Sam, more numbers again today, just every day.
More numbers again today, yes. And as we have done in the past, the numbers that we will be reporting to you are St. Clair County residents that have been tested. And as of today, we have 1,307 residents that have been tested, with 312 that are positive, which is an increase of 12 from yesterday. And that includes both males and females from the 40s all the way up to the 70s. We are at 939 negative test results with 56 test results still pending. And I'm happy to announce that we have no new deaths to announce today. We are at 19. For state totals, we are at 154,997 that have been tested, with 33,059 positives, which is an increase of 1,551 since yesterday. And we are at 1,468 deaths, which is an increase of 119. And our thoughts and prayers go out to the families who have lost loved ones to this virus, and also to the medical providers that took care of them. For our hospitalization numbers, and please keep in mind that these are hospitals that are in St. Clair County, we have 72 COVID-related patients that are currently admitted, and 5 of those patients currently on ventilators. For our long-term care facilities that are in outbreak status, and please remember that includes residents and or staff with 2 or more COVID-positive results or COVID-related symptoms at one facility. That is, first one is Bria of Belleville with 12 positive cases and 1 death. Colonnade in O'Fallon, which has 2 positive cases and no deaths. Four Fountains in Belleville, which has 13 positive cases and 1 death. And Memorial Care Center in Belleville, which has 13 positive cases and 1 death. And something I would like to touch on quickly before I turn it over to Chairman Kern for his update is, during yesterday's briefing, there were a couple questions that came in regarding what is close contact and how does that apply to when we do contact tracing, or if you have been in contact with someone that is COVID positive. So as the CDC defines it, close contact is sometime when you are 6 feet or closer to someone for 10 minutes or more. So if I am at Walmart and I'm walking past someone who just happens to perhaps be in the checkout lane next to me, chances are I'm not going to be within that distance of 6 feet for more than 10 minutes. So that is the qualification criteria that we use for close contact when we do our contact tracing that is provided by CDC. So I just wanted to clarify that. We did have a few questions yesterday. So now I will turn it over to Chairman Kern for his update.
Great, thanks, Sam. And when you find yourself 6 feet, within 6 feet distance for a period of 10 minutes or more, write those names down in a diary so that if you would eventually test positive for COVID-19, the professionals will be able to ask you that question, who are you with, and you'll be able to answer with certainty, these are the people that I was with at that time during the period you're inquiring about, so that you have an accurate reflection, so that we're sure that we stamp this out, stamp the spread of COVID-19 out. We've said it before, but we haven't said it for a few days, and we ought to remember to thank our emergency service workers, our law enforcement professionals, our firefighters, our lab workers, all the medical professionals, the doctors, the nurses, the cleaning staff, not only in the hospitals, but in the government buildings, at your grocery store. All these people are stopping the spread of COVID-19. We need to remember to thank them. Also remember those grocery store workers, the people that are there to sell you your food, that keeps you going and sustained. They're going to work. They have families that they have to go to at night, and they're taking a certain amount of risk on to carry this to their homes. So thank them when you see them. Be pleasant. These are stressful times. Sometimes it's easy to be short-tempered. Try not to be short-tempered. Try to be nice. Be kind to each other during this period, and we're all going to get through this in a much better fashion. We're going to get through this. It's just going to take a little time to be able to get back to our normal lives. So today we're joined by Steve Tomaszewski. Steve is the Corporate Director of Communications and Development for Touche Hospital. Steve, welcome. Thank you for being here today.
You're welcome. Thanks for having me.
So, Steve, let's just dig right in. Your hospital and the has started testing sites in East St. Louis, soon maybe in Cahokia, West Belleville. I know those are planned. How's all that working?
Going well so far. We have a simple number, so no matter which of the current site in East St. Louis or the future, you'd call the same phone number. So our screening number is 618-646-2596, and you'll be screened by a provider, so a mid-level provider will go through the screening process to see if you meet the qualifications to be tested. Right now, you would present yourself at East St. Louis at our Windsor Health Center, and it's a drive-through facility. So you would come in and they would check you in, and then you'd park and be tested.
So I noticed through your testing that you didn't test everybody that showed up or everybody that called. Can you kind of go through the numbers and say,
Right.
well, and you only have a few days, so you've been
Right.
up and running since Thursday. Today's Tuesday.
Thursday was Thursday and Friday were kind of partial get up and running days. Yesterday, so my numbers, and yesterday was a full day of screening. So through yesterday, we had screened 63 people on the phone. 24 of those qualified to be tested, and we've had one, which would have just been from last week, one positive. I don't have our results yet from yesterday's tests.
But out of those, how many tests was there one positive out of
24.
out of 24?
Well, no, because 24 includes yesterday, so I don't.
Okay.
I'm sorry.
Well, I won't hold you
Yeah.
to that, but
So-
it's not certainly not a huge ratio that are testing positive.
Correct, not yet.
But people are experiencing symptoms.
I would say there was probably about 1 out of 10 out of last week.
So then, can you talk? You're ramping up to other locations. Is there any announcement?
Hopefully later this week we'll be able to announce the exact locations and our start dates, but we are looking to add at least one more site here in St. Clair County this week still, and we're looking beyond that as well then.
And you're encouraging people to go get tested if they're experiencing a symptom, if they think they've been exposed. What is the criteria?
Yeah, to get tested you still need to meet the requirements, and those are the symptoms, which are of course fever, cough, and shortness of breath. You might qualify if you have been exposed to somebody, so somebody in your household or somebody close by did test positive that you were in that area. Healthcare worker or first responder could have possibly been exposed and could be eligible for testing. Age as well, senior citizens are more susceptible, and let's see, and yeah.
And so
covers
contact
it.
tracing that Sam talked about earlier, it's possible that you could be contacted by the health department or by an agency saying, hey, you were in contact with a COVID positive person, go to Southern Illinois Healthcare Foundation, Touche's testing site,
Right.
and get tested.
Yeah, call in to that number, to the 646-2596, and then they'll screen you to verify that you do meet the qualifications for the testing. We still have to go through that process. We're not able at this point just to take people who want to get tested or think they might. They would have to go through that process.
So Touche is active in the community and has been for many years. You have a resource line that's opened up. Can you talk about that a little bit?
Yes, so we obviously have the only inpatient behavioral unit here in St. Clair County. We also have outpatient services, and right now, because of the restrictions, we can't do those outpatient group therapy. So we have trained therapists who are available, and that number is 618-482-7158. So if anybody who wants to call, it's a free service to the community. If you're home alone, want to talk to somebody. If you're a healthcare worker, first responder, just at the end of your shift, just had a bad incident or something and want to talk to somebody, our therapists are there to talk to you. You're positive and at home, or have a family member that you're worried about who might have been exposed. Anybody who feels that need, that just needs to talk to somebody, kind of walk through it, and instead of I'm not clinical, so I don't want to use.
It always helps to be able to talk to a
other-
stranger in an anonymous way and
Right.
and be able to let loose and say, here are my feelings. Nobody will know. There's no record kept of the call, but it's something that's a service to.
Correct. Absolutely. So anybody who has a phone, really, there's not a geographic restriction on. Same goes back to our just another note on the testing site. There's not a geographic restriction there. So if you meet the qualifications, you can show up. And another point. Sorry, I'm going back to the testing.
That's okay.
There's no charge to people. So if you have insurance, we will take that information. If there's a copay, we're not collecting the copay. If you don't have insurance, we're not asking you to pay anything. So it's a free test if you qualify. Same with the resource line. There's no charge for that, and anybody who can call in. We posted it on Facebook, and folks from out of state were asking, hey, can I call in? So we're there to help.
And people need to kind of keep their ears open, and we'll be announcing here when it happens, but we think that perhaps the requirements are going to be loosening up with testing.
Yeah, so our testing site is state supported, and the governor last Friday, I believe, kind of announced that they would be loosening some of the testing requirements. So as you call in, if those change, we'll have them made on the back end, and more people would be eligible, and we would also announce what those changes are as they happen. But at this point, we haven't deferred from what I said our testing requirements are at this point.
So the digital age has changed a lot of the way we respond to this as compared with in the past. Telehealth has become it has been for a while, but with this pandemic, seems like it's being utilized more. Can you talk? Touche
Sure.
has telehealth.
Right. So I'll start on the SHF healthcare side. That's more of our primary care clinics that offer family and internal medicine, pediatrics, OBGYN services, and behavioral health. Those are being available for telehealth as well, so you just need to call your local SHF office and they can schedule you. Touche then offers the specialty services, so if you had to been referred for some additional care that you might need. So right now, at our Archview Medical Center in Sauget, which is affiliated with Touche, they're offering telehealth for pulmonology, ENT, ear, nose, and throat, some podiatry services, urology, nephrology, which is kidney health, and some GI services as well.
And is that has to come from your doctor, or if you call
So those specialty services would be by referral most of the time. There could be the podiatrist might not need a referral, but so you can call Archview, and I should have wrote that phone number down, but I'm sorry, it's on touche.org. You can get our specialty service information there, but they can call and see if they need that referral or not.
And touche.org is how they access the telehealth for the Healthcare Foundation, for the specialties
right.
at Touche.
SIHF would be through SIHF.org.
Okay. All right. So is there anything else you want to talk about? Tell the people
Sure.
Just how this is happening. How's the hospital operating?
Sure. A couple things on the hospital side. So we have set up a tent outside our emergency department. So if that surge would come and the ER is just not able to manage all the people at one time that would be showing up, we have the tent so that we can screen people outside, keep the potential COVID-19 positive or potential positives separate from other ER patients, do screenings, and then decide what the level of care they need from that point. We haven't had to activate that yet at our facility, but it's set up and ready to go whenever we need to.
And readiness is a comfort to people to know that if this would take a turn that we're not expecting, you're ready for that.
Correct. And we have an agreement, so some of our SIHF providers have already volunteered, so when the hospital needs that extra staffing, we're able to shift some of those resources over to the hospital.
Your doctors and nurses and all the staff, are they stressed out now? Is this a stressful time?
It's put a little extra pressure on folks, and it's a little more stressful, especially when you have that first case that came in. You know, it's but then the training and the preparation and stuff kind of falls into place, and people just respond more naturally then.
Great. Herb Simmons?
Fine, thanks, Steve, for coming in. Just a couple of questions.
Sure.
To go back to the testing.
Yeah.
You have the screening process. I call, you do all your screening. do I get an appointment time to come in? How does that work?
Yeah, so we would give you a general time frame, let's say between 1 and 1:30, if you could show up then, so that we kind of can space people out, so you're not having to wait so long in line if there is one. So yeah, you would be given a general time frame to show up at the facility.
Okay, and that test site is at the Windsor Medical Building, they're next to the old former St. Mary's Hospital?
Correct.
In East St. Louis?
Yes.
So what if I'm just driving through there, or somebody is, and they say, I'm gonna stop in and get tested? What procedure happens then?
So we would actually kind of let you come onto the parking lot and call then if you're on site. So you could be diverted. You wouldn't necessarily get right in line to test because you haven't gone through screening, but we would let you pull over into the parking lot, call the phone number, see if you're eligible to be tested or not. And then if you would meet those requirements, then you could get back in line to test. If not, we'd ask you to, leave.
Very good.
And,
So-
and the parking lot's on the 9th Street side?
Correct. You have to right. The address is 100 North 8th, but you access the parking lot off of 9th Street.
Yeah, it's one way
Yeah, their 8th is one way
going
What-
north.
east,
Yeah.
and 9th is one way west. Sorry, I had to think about that.
We
And-
forgot our compass today.
Yeah, exactly. And so, so there should be signage on 8th, not to pull into the parking lot there. And we do have patient parking still for SHF offices that are still open, and the Medicaid pharmacy. So there's some parking right next to the building for those. We've moved staff parking across the street. And so
And is the testing done in the vehicle, or do they
you
get
remain in your vehicle the whole time, and even our future sites that we're looking at, you would remain in your vehicle. We would have parking spots or somehow designate where to go, and then we would come out to you for the test
Very
collection.
good. I think that
And-
answers a lot of the questions.
And we're talking about the city of East St. Louis, the city of
Oh,
champions. That's where.
Correct. Yes,
that's
the
where this.
100 North 8th is
100
St.
North
Louis.
8th.
Yeah.
Yes.
For anybody that wasn't aware.
Very good. Thank you very much, Steve.
Oh, you're
Appreciate
quite
it.
welcome. No
Good.
problem. Glad to be here.
Good.
Thank you,
Chairman?
Steve.
Zip codes.
So today we've got our zip codes to report, as we always do. Remember that if your zip code is not named, it doesn't mean that you don't have anyone in it that's COVID positive. It just means that it hasn't gotten to the level of 5 yet, at which point the state allows us then to announce that zip code. So in 62201, there are 8. 62203, there are now 11. That's an increase of 1. 62204, there are 9. 62205, there are 10. That is an increase of 1. 62206, there are 24. That's an increase of 2 COVID positive cases. 62207, there are 17. That is an increase of 2 COVID positives. 62208, there are 21. That is an increase of 2. 62220, there are now 22. That's an increase of 1. 62221 remains static at 28. 62223, there are 20. 62226, there are 45. That's an increase of 2. 62258 remains at 11. And 62269 has an increase of 1 at 25. So we appreciate getting those numbers out. Brian Whitaker and Randy Randolph put those together for us, and we sure appreciate their work. Today we're being joined by a good friend, the mayor who's familiar to many of you, the mayor of Mascoutah. Jerry Dougherty is here today. Mayor, welcome.
Thank you.
So tell us, how has Mascoutah adapted to COVID-19?
Well, we're doing very well. First of all, I'd like to thank you, Chairman, and Herb and Brian and Health Department, and everybody else for keeping us up to date and informed on what's going on. You've done a wonderful job, and told Brian Whitaker's become a household name. With with the emails we get from keep us up to date on what's going on.
I thought that was Forrest Whitaker that was the household name.
Oh, you did. No, it's Brian now.
Okay.
So, anyway, we did a public service announcement to our citizens, and I did part of that. And our city manager did part of it, and our police chief did the other part. And so, trying to get out all the information that we could about what's going on with this, and we've been pretty well kept up to date by you and sitting on the governor's conferences and even the city of Chicago sometimes. But basically, I'm really proud of our citizens because we went out and appealed to them to abide by the directions and guidance that's been put out there, and we haven't had really any incidents where we've had any major violations of those. And I'm proud of the EMS and police and everybody that's been keeping up with this stuff. And as far as our city goes, we've adapted somewhat like everybody else as far as our work habits and how we do things. And part of our administrative staff is working at home, and we're finding out that technology is allowing us to, do the same job at home that we're doing in the office, actually. And and as far as our people, our public works people, we've been trying to have some work arrangements where we, keep employees it's kind of hard to do, but keep employees as far apart as possible so that we don't get, any specific group or department, down, all sick with the virus. So
And you kept your employees working during this time? You've got them working from home?
we have, yeah. We have. I know some people have looked at layoffs and stuff like that, but we have not had to do that yet. But we constantly keep tabs on things. We are not a big sales tax city. But we passed our budget the other night, but emphasized that just because we pass a budget doesn't mean you have to spend the money. And so, in fact, we've sort of laid down the law that any big expenditures that are out there, hold those off, because we don't know. Most of we're going to lose some taxes, and a lot of the others are going to be delayed. So we don't know how long this is going to go. And I would just say that right now, it's kind of feedback I'm getting is, it's getting warm and everybody wants to get outside and they want to do their thing, and we're just asking people to hang on. And I know it's terrible. I mean, I hate not being outside myself. And we talked earlier about golf courses not being open and things like that. And I hate. I'm a sports addict, and I hate. There's nothing except watching the same football games over and over again and stuff like that. So I know it's going to be difficult, but I think the real danger is that people start seeing the warm weather and everything, and we start gravitating towards trying to get back to our normal lives, and we just need to hold off on that, because if we get out there too soon, we could have a big setback, and we don't want that. So.
But people still are walking around your community, and they, as long as they stay 6 feet from people they don't live with,
Right.
That's not a problem.
No, I mean, I encourage people to get outside and enjoy the sunshine, but as long as we maintain the social distancing and stuff like that, I don't see anything wrong with that. But
So your police department has a great reputation. You've done a good job. Your chief's done a good job. Do you credit the good working relationship that your police department has with the community to being able to say that the governor's executive order is working in Mascoutah?
I think so. I mean, our police are always out there, talking to the citizens, and it's. I mean, they're not known as a police department that goes out and writes up a lot of tickets and stuff like that. They'd rather go out to talk to people first. Of course, sometimes you have to do what you have to do, but I think just the presence of the police, patrolling and stuff like that is enough. And we have had some fire department drive-by birthday parties, and I think some other people have had stuff like that. But that's good, I think.
As long as you're socially distant. So getting into that, have you had? I know many people refer to Mascoutah's homecoming as the county's homecoming. Since the county fair no longer exists, is that still on? Are there any talks?
It's still on. We've had in fact the guy that used to run the Sparta radio station used to call it the Mascoutah State Fair out there. But and I don't know where all the people come from, but we grossed $250,000 on that homecoming last year, and it's like 3 or 4 days. But we're not looking at the homecoming. We have Springfest coming up in June, which we could still possibly do that. That's not something that takes a whole lot of planning like homecoming does. And then we have a big 4th of July celebration, so we have to look at those events and see,
When it gets a little
see how we
closer.
stand. Yeah, so I know that Mayor of Belleville said they've already canceled some of their things, but those were, I think, much larger events that caused a whole lot of. Homecoming does take a lot of planning, but the others, we could probably let it go, till it's closer to the time.
And the Belleville events, I think one was in May, one was the end of May or beginning of June,
Right.
and so I guess we'll keep our eye on it, and people need to watch here.
Yeah.
Herb Simmons, you got anything for the mayor?
Always good to see the mayor. I know a little bit about being the mayor. And so one question, I know your police department, your EMS and fire department, we've talked with them weekly and sometimes daily, and they've done a great job. But what about the citizens being the mayor? We talked a little bit before we went on today. It seems like the mayor is supposed to know everything, supposed to have all the answers to everything. Are you getting many of those questions from your residents?
See, I get relieved a little bit from that because we have a city manager form of government.
Okay.
And so I do things like this. I go to meetings, but as far as the day-to-day operations go, that's the city manager's responsibility. So we like to say city manager form of government is the mayor and the council make the rules, and the city manager is the one that carries them out. And that's real basic, but that's about what it amounts to.
So you're saying the buck stops there?
The buck stops there.
I need to maybe think about that.
Yeah.
Yeah. No, we really appreciate you taking the time to come in today and being on the conference call every week with us. You've always got a voice of reasoning, and the day when we had the call, we really appreciate that, and we're just happy that we can count on you and the Muscuda residents.
Okay.
Very good. Thank you.
Thank you, Mayor Dougherty.
Appreciate it.
We appreciate it.
On the EMA side today, we distributed to 28 agencies, picked up supplies today, and they're still picking them up between 1 and 4. We had the conference call this morning with IEMA over more order of PPE, and for those of you who may just be joining us, PPE is personal protective equipment for our first responders and our nursing homes and those needs. And as I said, we had a conference call, our weekly call with the mayors and the police chiefs, and as the chairman said, I can't speak enough for the cooperation that we're getting from all those agencies. If there's an issue, we call them, and boy, they're right on it because they know we're all in this together. We're going to be back here in just a few moments with Cindy. I want to give a shout out to one of our ladies, Daisy, who's got some personal issues going on right now, and our thoughts and prayers are with her and her family. But we'll be back with Cindy to have this translated into our Spanish community, and then we'll be back here tomorrow afternoon at 3:30. So stay home and stay alive.